Can I just begin by welcoming you to this plenary session on child protection and evidence. Before we get started, just to tell you that we'll be having 3 presentations followed by questions. You're very welcome to use the chat. I know that our presenters will welcome your comments. My name is Fiona Campbell and I'm the Managing Editor of the Campbell Child and Adolescent Wellbeing Group, and I'm going to be co-chairing this session with Giordano Pérez-Gaxiola, who is the coordinator of Cochrane Mexico and a paediatrician. And we're really pleased that you've been able to join us today. I'm just honoured and very privileged to be able to introduce our 3 speakers. Yesterday, a journalist was reporting on the death of another child. They said, if we can't protect children, what on earth are we doing as a society? The 3 plenary speakers that we have today have dedicated their life's work to protecting children through research, through advocacy, through their practice, and it's a great honour to have you with us today. Professor Eileen Munro, Dr. Joan Nyanyuki, and Professor Lucie Cluver, welcome and thank you for joining us. And I'm going to hand over to Giordano now to introduce our first speaker.
Thank you, Fiona, and good morning, good afternoon to everybody. Thank you for coming. Our first speaker is Professor Eileen Munro. She's an emeritus professor in social policy in the London School of Economics. Eileen is a member of the ERC-funded project Knowledge for Use that is based at Durham University. Her current research in the ERC project is a case study of the underlying causal processes of the English child welfare system, studying reforms in local authorities that are implementing signs of safety as the practice framework. The aim is to identify and substantiate methods for appraisal the effectiveness of the work. As a fun fact, Eileen has just taken up the piano. Please go ahead, Dr. Munro.
Thank you. So are my slides now visible to people? Yes, I will assume that they are. So the title is What Evidence is Needed to Use Research in a New Context. I think we can all agree that we'd like to see workers in child protection using research more. I think I see a lot of them not using it, or even worse, using it inappropriately or oversimplifying it or distorting it. So the next slide, please. It is the outline of what I want to talk about. The problem is that we are studying complex social systems when we are trying to change the behavior of the workers in how they interact with families. There's a lot of ripple effects from that, which we have to pay attention to in order to make it easier for them to work in the way that we want to see them doing it. And then that they are, let me just getting used to this particular software. I'm not used to it. So in terms of what does complex causality look like in a child protection agency, I have a scary example for you, because I did a review of the English system with a systems analyst helping me to actually develop what's called a causal loop diagram of some capturing some of the major causal drives that were going on in the system. And then the conclusion of my argument is that we need to understand more about how anything works in order to be able to see whether putting it into a new context will have all the factors in place that enable it to be used and to have the right effect with the families and the children that we're trying to help. So moving on to the problem, yeah. Social systems are open. I suspect most of you are familiar with this kind of concept, but they are interacting with these systems around them. In any child protection service, we are painfully aware of with the wider society and with government. The wider society has very, very high hopes of what we can achieve, and we know that we can do some good, but we can't be perfect. The government wants us to protect all children, but generally, well, at least in Britain, is a bit reluctant to fund it well. And so even within what is much more closely the child protection system, there are so many other factors limiting our options. And any new kind of input, like trying to introduce some research knowledge or some new way of working, influences how they behave. It starts to interact. It's an active ingredient in the mix. And systems adapt to maintain their goals. So a fantastic example of that was something experienced of how agencies adapted to work during the COVID-19 pandemic. You know, the quite dramatic way in which departments in England adapted to working from home primarily was really quite impressive. And it had a lot of consequential defects for people, but it was also, it kept them going, kept them functioning. And closed systems are much more easily predictable because there are universal laws. Dealing with something like gravity within the Earth atmosphere was able to do very precise calculations. But in a complex system, the causal impact of a new input is less predictable. We may be able to say that X is more or less likely to produce Y, but generally speaking, we're dealing with probabilistic language. If for Britain, the kind of weather we have is difficult to predict. So our weather forecasts always have probabilities about them. There's a sort of 14% probability of rain. I stayed a few months in San Francisco, and there was no difficulty about predicting the weather there because it was just sunny every day. It was a section of fog and a section of sun every single day that I was there. And so X may have a different effect at another time or in a slightly different context. It's that level of probabilistic causality that is the difficulty for us. So this is, it was mentioned that I've been involved in a philosophy project. My degrees are actually philosophy, and in dealing with causality, one of the most useful kind of ways of understanding the kind of causality we're dealing with is about Inus conditions, which is something that is an insufficient but non-redundant part of an unnecessary but sufficient condition. That is difficult to get your head around. But if you think about the diversity of children, even within the same family, one may grow up to be extremely dramatic, another child may not. It isn't at all straightforward to say that adverse childhood experiences will have any predictable effect. You can say on a macro level that the more that there are in a child's life, the more chances there are that they will have problems. But there's also the remarkable subgroup of people who seem to become strong with those adverse experiences. So that is the families that we're working with and trying to predict their behavior has that limitation. So when we're looking at trying to introduce a new way of making a new intervention, I worked with the implementation of signs of safety in England because I wanted the opportunity of observing how people tried to implement it. And what became, I started the process with the assumption it wasn't going to be simple, but in fact, it turned out to be even more difficult than I'd expected, in that the bringing in what's called signs of safety had to go into a living human social work agency in the English system with all of the factors around it. And all of those, my review of the English system had shown how many of the factors around it were actually adverse and pushing people away from engaging well with families and being able to predict what they might do and also to help them to improve them. So this is the diagram. I can't actually understand it any longer, but it is a causal loop diagram of the kind of drivers. And what it showed was that with the best will in the world, the attempts to solve problems kept going for the idea of more and more rules and procedures. And it ended up driving the system so that the time spent with families, the time on professional expertise became less valued. The inspection system just looked at whether you were collecting the right data, not whether you were engaging well with families. nobody was collecting evidence on whether children were benefiting from our involvement in their lives, which should have been the best feedback driver of all, of telling us if we were going right or wrong in what we were doing. So the Signs of Safety, the author of it, Andrew Turnell, was very influenced by my review. And instead of having, his experience has been that trying to implement signs of safety in various agencies around the world had very limited traction. It really caught hold in some places. Others were very, very enthusiastic and used it for a while, but gradually it got nibbled away by other pressures and eroded. And so he actually then developed a whole theory of change about the organizational system, about what were the main drivers that needed to alter from towards actually having a clear focus upon the work with families and about feedback to see whether you were going on track or not. So the theory of change we're more used to is of a simple linear line of you do this and then that, and you'll get the outcome you want. Whereas his is a much more confusing one of some of the major factors within it, and the child and family being at the center of it. But it's about, on my right-hand side, it'll be your right-hand side too. This is the next slide. Sorry. No, the next slide. That's it. No, keep going. You've got way behind somehow. Keep going. Keep going. There it is. Yes. So most of it on the right-hand side is about the organization, about how you audit the work, what are the messages that leaders give about priorities, and their understanding of how much accuracy we can have in doing risk assessments. That's a really powerful driver. When the director says that we will protect all children, it sets an absolutely impossible goal, which ends up harming what practitioners do because they're so scared. They become extremely defensive in their decision making and they want to avoid blame above everything else. And that was partly what pushed the dominance of procedures into the English system, that the time that they spent with families and the skill that they developed there was invisible to their managers. And when it's not reinforced, it tends to fade. But the diagram there, you will notice that the cogs are actually with very bumpy edges. And that's because they're not like the cogs of a clock, which always connect to the same predictable way. They are slightly moving all the time. So sometimes they will be interacting healthily and sometimes there'll be a bit of an obstacle. So the next slide, please. The aim is to change the interactions in the system so that they focus on the quality of the work being done and less on the quantity of the work. And because we were implementing signs of safety, it was whether there were visible signs of that way of engaging with families, that kind of analysis of the problem, the kind of process for working with a family with an aim of getting out of their lives. So next slide, please. And what we found was we worked with 10 local authorities and there were 10 totally different causal stories. They were, 3 of them, the Ofsted inspection judgments were used because they were an independent judgment, but 3 moved up to outstanding, 2 moved down to inadequate, and 5 made slow improvement up 1 grade. This isn't what we wanted. It isn't what we had hoped for, but it was, when I did a subsequent analysis of what had gone on, it was the way that the ones that moved up to outstanding had tried to implement the whole of the organizational theory of change, and the others had implemented parts of it. So in the worst of them, you could see hardly any trace of signs of safety being worked with families. So next slide, please. The kind of causal drivers that were there was when the supervisors started discussing the casework, the professional reasoning, and not just whether they were complying with process, which had unfortunately become the major way that supervision was carried out in England. The audit process used to be a sitting down and looking at the file online and seeing if it ticked the right boxes, whereas now it was a collaborative task which was seeking to understand why the audit work did, not hindsight. process meant that the manager doing the audit was brought back in touch with the complex reality of day-to-day practice, because the manager didn't know what happened next. So that they were fully experiencing what the worker was doing in making a difficult decision. Leaders turned out to be hugely involved in influence on what workers did, in the messages they gave about how important their work was, or whether the important thing was having good records. And having more feedback from families and children was actually something that influenced people. When they got good feedback, it would help them change their behavior in line with it. So next slide, please. So the aim is to understand how things work. What are the mechanisms that bring about it? So a lot of you, I expect, are familiar with the realist synthesis approach, realist evaluation approach of not what works, but the much more modest, what tends to work, how does it work, for whom does it work, and in what kind of context. And that, I think, when we are trying to change social work or child protection practice, I think it has to be at that level, and it has to be something that the managers understand. It would be even lovelier if the politicians understood it as well, and perhaps we will get there one day. So the next slide, please. So what I'm arguing for is that instead of the intervention-centered approach, which you will all be very familiar with, of the typical RCT, which has its place. When you're dealing with a very discrete variable, you can administer an RCT very well indeed. But when you're actually trying to introduce a much more complex kind of intervention, then you have trouble. And what I would like to see, the next slide, is the context-centered approach, which is focusing on the arrangements in the target context, and whether it has in place the kind of causal processes that will enable the intervention to actually function and have the desired change. So I realize that I'm close to my time. So when we go to the final slide, I think, is there a final slide or is that it? No, that was it. So it is to me, having been involved in this action learning on the implementation of signs of safety, was a realization that it would be very nice if the RCT were able to be used everywhere, because it is a lot more controllable. This is a more challenging way of studying, but I suspect that the more that we do it, the more that we will have templates or easy advice on what to do, that it will become more manageable, and that we will, my suspicion is that we would find that there are some key areas of drivers that you have to focus on in order to support a new way of working. But I think if we need to move away from the RCT, because too many people have the experience of taking an evidence-based intervention, putting it in, and it doesn't have the effect that they had hoped for. And so it turns them off research. And I think this will be a much more, in the long term, a much more effective way of actually taking all the benefits and being able to use them to actually protect children and support their families better. So I will stop there, and I hope there's some questions.
Thank you very much, Professor. Are there any questions?
You should have planted one.
There are no currently in the box. Please do feel free to use the chat box and add your questions to it. But in the meantime, Eileen, I'd love to ask you a question. You mentioned some really profound problems with using evidence to inform practice. One of them being the RCT. Another that just the right things aren't measured, and and perhaps a poor understanding too of the application of theory in this field. I just wonder if you could say a bit more, and particularly sort of as a reviewer, thinking about how do we undertake reviews that are useful in this area.
You've really asked a difficult question. There's a great temptation, I think, if you're reviewing research and trying to make it applicable, you want to simplify it enough to be usable. but you have to not simplify it so much that you distort it. And you have to remember you're giving it to people who have too little time. One of the bits of learning I've had from research, which I think is really important for everyone to bear in mind, that trying to think logically and analytically takes more energy than thinking intuitively. So if you are working with social workers, child protection workers who have very busy, heavy caseloads, you need to really prioritize the time and the energy. You know, sometimes in England you find supervisors doing supervision at the end of a day when people are exhausted. It's a very bad time. I think everyone, at least within England, everyone now at least understands that in theory research is really important. You know, nobody challenges research, but it's finding people that is the more difficult problem. But at least you've got to the first hurdle of it being a desired thing.
Thank you.
So the door's a bit open.
Yeah. And do you think there is a change within social care?
Certainly within my career, there has been a substantial change. I came in not long after the big RCTs of psychosocial casework and their very negative findings, which seemed to actually put people off research for quite a while. So now there is a much greater emphasis and quite a lot of good research, which is fairly small scale. It's only attempting to check whether we're having the effect that we wanted, rather than trying to draw out universal findings. But it's giving more and more people core research method skills.
Any other questions? I can't see any more in the chat. Professor Munro, thank you so much. I think we do have one here from, what are the good methods for enabling feedback for how children are doing? You probably need an hour for that one.
Well, actually in Ireland, they are doing a study of children who are still at home. There's a lot of research done with children who have been in out-of-home care, but they're actually doing one with children who are never taken away from home. And it's a pilot study to begin with, to see if they get the methodology right so that it's worth doing on a larger scale. But even with the small number of interviews they've done so far, they keep hearing things that, you know, when you hear things that, when your attention is drawn to them, you think, well, that's so sensible, that's so obvious, why didn't I think of it? But they have been finding that children are incredibly articulate about their experience of being involved in a child protection investigation. And so I think that's a really good study, and it'll be really interesting to see if the end result, but it also may give others a sort of a prototype of the methodology. But children are they're making sense of what happens to them in the child protection experience, as they are in life in general. And we don't pay enough attention to them as active human beings. They become objects of concern in so many cases. But actually realizing that you not only are trying to protect them, but you have to act in a way that promotes their overall development. You don't want to traumatize them. You don't want to make them feel helpless. And I think a lot of the times when you're so focused on adult worries, you forget the impact you're having on the children that you are allegedly saving.
Thank you. We're having a slight change in the programme now. Professor Munro, thank you so much for that fascinating start. Can I hand you over to Giordano again to introduce Professor Cluver?
Sure, Professor Lucie Cluver. She's from the Department of Social Policy and Intervention of the University of Oxford. Lucie Cluver is a professor of child and family social work in the Department of Social Policy and Intervention, and an honorary professor of psychiatry and mental health at the University of Cape Town. She works closely with governments and UN agencies to provide evidence that can improve the lives of children and adolescents in sub-Saharan Africa. Professor Cluver has an exceptional track record of impact, and in the past 3 years, she has been awarded quite a few awards, like the ESRC Impact Award in 2021 and the European Union Horizon Impact Award in 2020. Lucie is lucky to work with an incredible and dedicated team of students, postdoctoral researchers, and colleagues. And as a fun fact, Lucie rollerblades to work. Please go ahead, Professor Cluver.
Well, thank you so much. And Eileen, I have to say that I was a child protection social worker in the UK around the time of Baby P, and everything that you were just describing it was humbling to hear what you were just talking about and thinking about how we can improve the child protection system. And I think, and Taryn, if you could put my slides up, that would be fantastic. What I'm going to talk about now, and I suppose where I differ from Eileen is that I'm a real believer in randomized trials. I find them enormously helpful. I feel that they give this fabulous internal validity. You know, recognizing that there are challenges with them, and that you know, particularly for governments and delivery of services. But what I'm going to talk about today is this kind of new area of work that we've been doing that really hits up against a challenge again with our randomized trials. And it's interesting that in this Campbell collaboration meeting, you know, we're facing some of these real challenges. And so I'd really love to hear, you know, as I talk, people's thoughts, questions, critiques, or your ideas of how we can move forward with this work, which is clearly essential, but also do it in such a way that we can be as robust and as rigorous as possible with the evidence base. So if you move to the next slide. That's great. I'll just wait until that moves. So if we all think back to perhaps 2 years ago and the early parts of 2020, and I don't know how many of you are parents or were looking after children or other people during this time. And perhaps if you have a moment, you could put into the Q&A just a number to describe how stressful caregiving was during that time, with 0 being completely unstressful and 10 being tearing your hair out with providing care for children whilst balancing other things and work. But what we saw globally was a huge amount of quite unprecedented level of stress amongst caregivers. And this has played out in subsequent studies. If you go to the next slide, this is just one example from Bangladesh. But, you know, there have been now over 800 studies showing very much increased rates of stress and particularly depression amongst caregivers of children. So if you could move to that next slide. That's great, thank you. And here we just see very clear rises alongside rises in food insecurity, and much of that stress was related to economic insecurity, as well as huge challenges around anxiety, concern. We were right in the middle of a global pandemic. If you go to the next slide, please. Thanks, Taryn. What we are in this kind of crisis situation that the world found itself in. We were in a very unusual context. And if you look at this as a kind of Bronfenbrenner model that we often use in child protection work, where we think about all the different support networks that we can engage to improve outcomes for a child and for a family. But if you go to the next slide, we'll see what this looks like in a crisis and in a health crisis situation. We see that all of those external supports are stripped away. And we were essentially left with a context where the only provider of support and management for the child was the primary caregiver in the immediate family. If you go to the next slide, and as we would expect to see from this, we've seen substantial increases in violence against children, a 30 to 50% rise in violence against children globally during COVID-19. That's UNICEF estimates, and it's been quite hard to measure. If we look then at what's got the strongest evidence of effectiveness, and WHO and UNICEF developed an INSPIRE framework, which looked at what's the evidence-based interventions. Currently the interventions with the most evidence base are parenting programs. And Frances Gardner has just completed with her team for WHO a massive systematic review of reviews of parenting programs. And over 400 reviews have shown highly effective result in preventing violence against children. And if you focus then in on humanitarian context specifically, that does reduce down to only 18, but with good and evidence of effectiveness. So then we immediately thought, in this context of COVID, this global humanitarian crisis, what could we do that would be something effective and deliverable? And of course, we had to think very differently, because what we've been working on for the past 10 years with WHO and UNICEF has been a set of evidence-based parenting programs. There's nothing new about these programs. Most of the evidence-based parenting programs are pretty similar. They'll tell you they're different and special, but it's a bit like McDonald's, Wimpy, and Burger King. They've all got a bun and some lettuce and a patty inside. So they've all got very similar ingredients. But many of the evidence-based ones are commercialized, and that, of course, has problems when it comes to scaling up in the developing world. So Parenting for Lifelong Health was created essentially to provide non-commercialized open-source parenting programs. Those have now been tested in 15 randomized trials, all showing effectiveness on violence prevention and other outcomes such as parental mental health and reducing sexual exploitation risks for adolescents and improving things like family budgeting. But of course, we couldn't deliver these in-person parenting programs in the COVID context. Most of us couldn't even leave our houses. Services, child protection services couldn't get to people. And so if you go to the next slide, we had to think about ways of delivering them in ways that could be delivered in crisis contexts. So we had to core down to what was the core content of these parenting programs. And what we see is that all the evidence-based ones are based on social learning and attachment theories. They have very core content like teaching about parent-child play, teaching about cognitive stimulation for younger children, non-violent alternatives for punishment. And they try, the effective ones all have similarities in that they use things like modeling and active learning. And of course, that becomes very, very difficult to do in a remote context at scale. And in COVID, we had the additional strong feedback that we needed to also focus very strongly on parental mental health in this context. What do we know about if you go to the next slide, what do we know about the evidence from these randomized trials? What we see, and this is a kind of summary of multiple randomized trials rather than a single one, is a whole set of positive outcomes on positive parenting, improved child behavior, not so much for adolescents, but strongly for younger children, more effective planning to protect children, reductions in violence, alcohol use, drug use, and mental health, some of mental health problems. And some of the trials more recently have started to measure intimate partner violence between parents and have shown positive effects. We've conducted cost effectiveness analyses showing strong cost effectiveness. Again, all of this then, we had to say, how can we try and achieve these outcomes and deliver them in a context of complete crisis when we couldn't see anyone? And so very rapidly, if you go to the next slide, we were able to bring together a group of international agencies and NGOs. This spanned from UN agencies to faith-based organizations. And essentially within a day, we were able to arrange that this group were going to work together to provide emergency parenting response during COVID-19. What we did was to effectively turn those in-person 12 or 14 session programs into the simplest possible set of tip sheets that we could. And if you go to the next slide, you'll see an example of one of those on the right. But essentially what we were trying to do was to say, can we pull out that core components and retain some of the core delivery mechanisms? You see, we're trying to make it fun and warm and engaging for parents, and deliver those to as many people as possible. Now, of course, simple tip sheets were not enough. So what we had to do was to turn those into multiple different formats. They were delivered by over 260 non-governmental organizations as everything from YouTube videos to radio broadcasts to television news to public service announcements. In places like the Philippines, they put them, because they had hard lockdowns and no internet access, they put them on data sticks. They recorded the tips on data sticks, stuck them in loudspeakers, and people walked up and down villages. They did this in Laos and in Cameroon, blasting out parenting tips. There was pretty much every possible interpretation. Because they were open source, organizations were able to adapt them as they wanted. And of course, this takes risk, because when we think about evidence-based practice, we often talk about fidelity. And at this point, when you've got to make such rapid decisions, you actually have to choose between fidelity and scale. And so we took what was, at the time, felt a very risky decision to say that this was completely open source. And in the entire 260 organizations, we only had 2 challenges with adaptations which risked changing the content, and we were able to adapt those swiftly. So I think it was a real lesson for us in the value of trusting other organizations with work. Over the next 2 years, these resources, translated into over 100 languages, were able to reach almost 200 countries. We completely failed in Equatorial Guinea and North Korea, but every other country in the world was able to access these. And through 33 national government programs. And in total, our low estimates of reach, we did a range estimate using UNICEF guidelines, we're able to reach just over 200 million families. Now, I think the key message for this, and if you turn to the next slide, I'll cover some of the evaluation findings. We were able to do pre-post, this was led by Jamie Lachman's, pre-post and retrospective surveys with around 1,500 people. The results of this were kind of so good, we almost don't believe them, that something so light touch could have such strong identified impacts. But I think the key message for us was around the desire, the urgency, and the articulated need for parenting support. Now, it wasn't necessarily articulated as violence prevention, but it was articulated as need. And actually, astonishingly, we had some extraordinary conversations where colleagues would ring senior government ministers, male government ministers, who hadn't necessarily been in any way interested in parenting before. But during COVID, their response was, I'm stuck in my house with my 4 children, please send me the tips. And we did see a real sea change in an approach to this child protection intervention. If we move on to the next slide, though, I think, we got to the end of that and we really thought that was it. And then in February of this year, Russia invaded Ukraine. And we were again faced with an urgent need for child protection, evidence-based child protection interventions in a context where, again, it was impossible to reach people because there was an active conflict and people were so rapidly on the move. If you move to the next slide, just to give some examples, we were able to again move rapidly to bring together a similar set of agencies, UN agencies, but to add new agencies like UNHCR, like the International Rescue Committee and Save the Children within the humanitarian sector. And we had to adapt and again include new content, for example, on prevention of child trafficking. But again, we were able to see this capacity to reach and this capacity for collaboration. And in 2 months, within 2 months of the Ukraine invasion, we were able to reach 11.5 million families. We're now working in Pakistan to try and support families during the floods and have just shared resources with 120 NGOs within Pakistan. So if we move to the next slide, I think this really has led us to think quite differently about provision of evidence-based parenting programs, and provision of programs in the context where families are at highest stress, at highest risk, but hardest to reach in these humanitarian contexts. And if you move to the next slide, I'd like to just really end by talking about some of the real challenges that are facing us as we're thinking about next steps. The first challenge is that emergencies seem immediate, but actually the impacts are hugely sustained. This is some work that was led by CDC, looking at the orphanhood impacts of COVID, that over the last 2 years, over 10 million children have been left without parents as a result of COVID-19. And this is just an exemplar, really, you know, if we can think of this for any crisis, that we will need to think not only about an immediate response, but can there be a sustained response? And can there be a sustained response for tens and hundreds of millions of children, not for thousands or hundreds of thousands? If you move to the next slide, thank you, you are rightly jumping ahead. We also need to think about, can we provide scaled up, evidence-based, very low cost and scalable versions of these evidence-based parenting programs? And Dr. Jamie Lachman and colleagues are leading a whole set of conversion of parenting programs into digital and hybrid digital formats, which are going to take that frustrating 5 next years to actually test, develop and test in randomized controlled trials. If you move to the next slide, we're also having to think about how we bring that into UN agency response into a sustained response. And several of these agencies have come together and made a public commitment to deliver parenting programs as a global resource. And they're all arriving in Oxford tomorrow for 3 days of intensive meetings as we really think through how we can do this best. If you move to the next slide, we're also having to think about not just parenting as an isolated intervention. It's one of our challenges in evidence-based research, is it's nice and it's always neater and easier to do a randomized trial on a single intervention, when in reality, the evidence, this is from an observational longitudinal study, suggests that simple packages like parenting support plus cash transfers or social welfare can be more effective. And finally, if you go to the next slide, we have to think about how can we sustain core principles within this research, not just that will be evidence-based, but that everything we do will be scalable and low cost, that it will be empathetic to the experiences of parents and children, as Eileen was saying, and how we can maintain an open source approach. If you go to the last slide, I'd really just like to end by saying this is only the beginning of what we're trying to do. We are absolutely still learning and would love inputs, suggestions, and critiques. But I do think that we are seeing something of a sea change. We are moving from child protection responses that are relatively small scale to the possibilities of taking high quality evidence and adapting it for national and global scale. The last slide is just to say thank you to everyone.
Thank you, Professor Cluver. Very impressive work. Is there a website we can check all those parenting emergency response posters and flyers?
Absolutely, I can send it over. We're still creating the Pakistan one.
Okay, thank you. Let's see if there are questions. Are there any questions? I don't see any more. Fiona?
Lucie, thank you so much. That was just fascinating to hear, and just so interesting how you had to get things going so quickly, and then it sounds as though as a result of that, some of the ways going forward have been shaped and changed. And you mentioned that you were surprised at how effective they were at some of those interventions. And I just wonder if going back to some of the things that Eileen was saying about context, was there something that you learned about what was working in particular contexts? Was some of that, when the context was changed so dramatically, did it allow you to see what are the core mechanisms here that mean it's effective?
It's a great question, and it's lovely to see Joan join. And Joan, your organisation was one of our many brilliant partners in this work, so a big thanks. It's a good set of questions, and I think one of the challenges is that most of our answers are that we don't know. You know, and this is what I remember right at the beginning when we started the emergency COVID response. My colleague Jamie said, should we try and build an RCT into this so that we can test its effectiveness? And we asked our colleagues in international agencies, and they said, no, we can't. We're in a humanitarian crisis and we have to move. That is the priority over the evidence building. And of course, that means, though, that we reach the end. And the reason I'm hesitant about the results is because we had, you know, like 90% of families saying it helped them reduce child abuse. It feels too good to be true, actually. And I think that's why, and of course, it's lots of it's retrospective, some of it's pre-post. What I think we'd like to do going forward is to try and at least look at effect sizes and compare effect sizes across the pre-post and randomized trials to see if we are getting similar effect sizes, then maybe that is an indication that that's a more robust finding. But I remain tentative about those findings. But I think these key questions that you're asking about, things like which components were most effective. Of course, the challenge is that we didn't have time to do, for example, optimization studies, which is what we'd have liked to have done, to try and isolate which were most effective. We had to use the existing evidence on things like core components analyses of parenting programs. And then we had to allow for the fact that they were going to be adapted to every country in the world with very different contexts. I wish I knew, you know. And then we had to reduce them again for Ukraine. And, you know, in Ukraine, they were being delivered, for example, to families as they crossed the border. They would put their phone down on a, as they went over the UNICEF border crossings, they would put their phone down and a QR code would put them onto their phones. And so, you know, we had to keep them really simple and really small and at social media level for that context. And again, at each stage, you're reducing and reducing, and you're not 100% sure if you're cutting out something that's core.
Yeah. Thank you so much. It's so interesting. I guess that's going to be part of the ongoing work, Lucie.
It is, not that we've planned it, but yes.
Okay. Lucie, thank you so much for another just fascinating presentation. I think we probably need to move on to our final speaker. And I would just say that Lucie's got to go off and give a lecture. So if she disappears from the room, Lucie, thanks again for joining us. And it's been great to have you.
Thank you so much, and lovely to see everyone.
I'd love to introduce our final speaker, Dr. Joan Nyanyuki. Joan is the Executive Director at the African Child Policy Forum, which is a not-for-profit, independent organisation that is based on the conviction that putting children first on the public agenda is fundamental to the realisation of rights and well-being and for bringing about lasting social and economic progress in Africa. Following her training as a medical doctor in Kenya, Joan has been a passionate advocate promoting gender justice and equality. She's led advocacy campaigns, movement building, supported local community organisations, and persuaded law and policymakers to uphold women's rights and gender equality. She was instrumental in documenting sexual violence and killing in Kenya's post-election violence of 2007 and 2008, and advocating for international justice, in particular justice for sexual violence survivors, women and girls. Now, we asked each of our presenters to give us a fun fact that wasn't on their bios. And Joan's was that she's taken up embroidery, but not just any old embroidery. And I've asked Taranam to put up a slide of the kind of embroidery that Joan enjoys doing. Taranam. So for those of you who haven't heard of profanity embroidery, there's something to go into look into. And perhaps is maybe an outlet for you, Joan, when you're tackling some of the very difficult issues that you do in your day-to-day work. Joan, thank you.
Introduction, I'm Fiona, and I will not be embroidering or using any of the words that I embroider in this presentation. But thank you very much for that. And so I think it's always an honor to come after such brilliant speakers, because I feel like I have the opportunity to tie together some of the things they have said at a very practical level and bringing it down now to the African continent. And so in my presentation, I'll be sharing mostly from the research work that we have undertaken at the African Child Policy Forum, and also as the African Partnership to End Violence Against Children, which is hosted within our organization. And I say this in the context that we work on child rights advocacy across 55 African countries. So it's also going to be very broad in terms of presentation and the evidence and such that we've undertaken. And as a starting point, I want to just sort of frame the conversation of child protection from where we sit on the African continent to say that we have identified a set of factors, and actually Lucie referred to them, of the different levels at which children are threatened, where vulnerabilities play out. And the first is always at the individual level, at the child's level, at the household level, where you have, for instance, loss of parents, loss of parental care, household poverty, disability, homelessness for children who live on the streets. So that's the first element that child protection we look at. And then we look at the second one, which is more around the systemic factors, whether it's the laws and the policies, whether it's at government level in terms of financing, capacity of the social workforce, regulation of sectors in terms of child labor, education, health sectors. And is the social cultural elements, which are communities. So there's the elements of community violence, community norms, social norms, whether they be promoting equality among the genders or not. And also here we bring in, especially in an African context, the elements of cultural practices, because the African culture is so strong and really effuses how children are raised and how children.
Oops. I think we have some technical difficulties.
Yes. Bear with us. We'll just wait a few minutes. I'm hoping that Joan will be able to rejoin us. Taranam, as I'm just wondering if you've got any indication of what's happened. Was it her internet perhaps dropped? I'm just going to quickly send her an email. I've just sent an email.
She's here trying to connect. We see her in the presenter chat.
Okay. Apologies for the pause, everybody.
Should we move on to a panel Q&A, or?
We can, I think, let's just hang on one second.
Am I back now?
If she's trying to get back in.
Oh, sure.
Welcome back.
Apologies.
No, don't worry, don't apologise. Do continue, because we were thoroughly enjoying that.
Okay. All right. Coming back. No embroidery. But I think I think looking at these levels of challenges, our work really comes from recognizing where the challenges are, where the gaps, and then trying to see what are the policies that work, what's working, what's scalable, and what's sustainable. And so I'll speak to you from a point of not looking so much at the challenges and from a bleak perspective, but one from more of looking at what more from, light a candle, don't cast the dark sort of mindset. And so I'm going to speak about 3 elements, and I hope you can hear me. Can you, Fiona? Fiona, can you hear me?
Yes, we can hear you. We can hear you.
Super, super. All right. I'm going to speak about 3 things, and now I think I'm going to have to run through this because of my internet. But I want to talk about the place of data and evidence. My second point of conversation will be about neglected and hidden children and concerns. And the third one will be related very much to what Lucie was speaking about and what did we learn from the pandemic. So I think one of the biggest challenges African governments face, because our focus is really advocacy with African governments for more progressive laws and policies, is that they try to make future decisions using very old, historical, outdated data. And so that creates a very big gap between where the country is and really where it needs to be going. And unfortunately, most African countries are also struggling in this area because they themselves do not undertake a lot of data generation, a lot of research. Most of it is externally driven. And one of the challenges we have seen with this is that when this externally driven and generated research and data is presented back to governments, there's a sort of hesitance to use it. And the uptake and application then and reflection in policy is limited. And so we are encouraged, of course, when we see the kind of work that Lucie and Eileen are presenting, which governments have positively taken up. And that's what we are trying to encourage more and more of, using data and evidence, whether it is locally produced or it is produced by other partners, so long as it is credible and it is really solid and tight. And so we are pleased, for instance, when we see that 12 African countries have undertaken already the VAC surveys, national surveys on violence against children, and are now using this data to inform the policies and responses on addressing violence against children. So one of the things that we also then work on, and as the African Child Policy Forum, is making contributions to really documenting evidence, evidence on what's happening at national level, but also at community level, and analyzing and packaging it in a way that is easy and simple for policymakers to use. Because one of the biggest challenges is when it's complex and heavy, then they have 100 demands at the same time. So how do we package it in a way that is easy for them to absorb, to take up, and then to use? That's one element. And the second one is also in providing technical assistance to undertake research on their own, but also to then be able to track and monitor progress, to monitor and track the progress that they are making in terms of policy implementation, so that can then be used as a point of learning and cycled back into continuous revision and refining of policies. And I think that's a place that different actors, academics, NGOs can really make a huge contribution. I want to go now to the second element of what I'm going to speak about, and this is really about the importance of policies to be inclusive and sensitive to children who are often invisible and neglected. And the second part is on issues that are invisible, neglected, and hidden. And so children who are often neglected have special needs. Most times it's because they have special needs perhaps because they're in remote rural areas where there is no access to government services, or they're neglected because they have disabilities, or they live in poverty, or they're in humanitarian situations, or simply because they are girls, especially on the African continent, or they're in child labor, or they're living on the streets. So how do we make sure that child protection policies are actually reflective of the special vulnerabilities and needs of these children? That's one important point. But the second one that rides on that is, how do we make sure that child protection policies address the more hidden, secretive, non-spoken forms of violence, which typically in the African continent will be harmful practices such as FGM, child marriage, sexual exploitation within not just child marriage, but within very hidden practices. And then there'll be others such as killing and attacks on children with albinism, children with disabilities. And the challenge then of child protection policies and programs not being inclusive of these forms of violations and children with these vulnerabilities is that we leave out the children who are in greatest need. You know, when we speak about the children who are at the last mile and the policies are not sensitive and inclusive to them, it means that there's really no way that we can say that we have universal reach or coverage of any of our policies or programs. But I want to use this I want to demonstrate one of the cases that we documented in Malawi, typically of this, where children with albinism, especially when they have disabilities, were not able to access any protection. But because of a lot of community activism, the first thing that happened was, of course, community activism, a lot of public outcry, but then this was coupled then with the legislation, with a law that was passed, and second, development of policies that were very clear on how children could be protected, children with albinism and disability. And this is a bit of a complex part because sometimes we argue, is it the law that should come first or the policy that should come first? Or should community activism and organizing be the one that actually catalyzes both of these? So it's almost chicken and egg, you know, cat and horse. But I think the final result we want is really to see that we have a place where actions are being taken by civil society actors, by governments to develop laws and then child protection systems and policies that are inclusive of these children who are extra vulnerable. So that's the second element that I want to speak about. And the third one, which is really about our lessons learned during the pandemic. And I mean, we know what the pandemic did. It wreaked havoc. In countries like Uganda, schools were closed for close to 2 years. You know, children were out of school. We had numerous cases of girls ending up in child marriage across the African continent. And once schools opened up, children not re-enrolling back into school. So that was one. But the second part of that is that children at home were exposed to lots more violence. And of course, it then makes sense completely and ties in with what Lucie was talking about the government executive who previously had never thought of parenting, but suddenly woke up and said, hey, I need to know how I'm going to take care of my 4 children when we're in lockdown. But I think the importance of this is that it did 2 things. And this is where I'm talking about, let's not cast the dark, let's light the candle, because I think in terms of child protection, there were a lot of candles that were lit. And one of them is that, and unfortunately, the first thing that we saw is that child protection services were locked down and closed in African continents. Social workers who work in child protection were then diverted to the COVID response because child protection services were not considered essential. So that's one problem. But because of the hue and cry of different child actors, we saw then political leaders and decision makers beginning to pay attention as they reopened child protection services and put them as essential services. Then we managed to have child protection pushed up to the national agenda, and not just as a child rights issue, but really as an issue that has national dimensions. It affects security, it affects political stability, and therefore the existence of the state. So I think when I talk about lighting a candle, I think for us in the child protection space on the continent, this is really a moment when we can capitalize on this increased attention on the gaps within child protection in various countries and see how do we make sure that we don't lose the momentum, but capitalize on that to make sure that child protection is then reflected in the national agenda, in national development plans. And therefore, with this political will, we can have the necessary resources allocated to it. So I think, and there's the evidence that shows all of this. So it's how do we make sure that we continue to advocate for this? The second part is really on how the pandemic again highlighted the loopholes, the gaps and the cracks within the child protection system. And not just of what I talked about before of the children who have special needs and special protection concerns, but really systematic, you know, across the board. And how these gaps then became an opportunity for us to really make sure that, one, actors are talking to each other, we can have referral systems that are functional, that we have actors sitting on the table and saying, how are we going to respond at this time? And so I think, and one of the biggest gaps was really on how segmented and broken down the child protection system is, because you need to have on it judicial actors, you need police investigators, you need the social workforce, you need even the correctional facilities. Because, for instance, during COVID, homeless children were rounded up and put in detention facilities for their protection and for their, to keep them confined and isolated from the virus. Yet in these institutions, there are no child protection policies and programs. So you ended up with children institutionalized and facing greater dangers than they would have faced outside without protection. And so this, and again, it comes back to my previous point on how we can really use this momentum and interest and focus at this time as countries are, building back better, recovering from the pandemic, to really make sure that good practices really are built in and good policies are built in. So that's a piece of work where we are really emphasizing. And I think on this, I want to touch a little bit about the focus we realized on response in child protection rather than prevention of violence, where the child protection system waits for the child to become a victim, to be abused, to be neglected, and then catches them when they're already falling. But there needs to be more emphasis on the preventive elements, on the positive parenting, on working with communities to change norms, on working with communities to make sure that children with disabilities are treated, the same as all other children. And this is really part of the Inspire package. And I think there's no question the cost of responding to violence versus the cost of preventing violence. I think everybody agrees that prevention is more effective, cost effective, but also more effective in terms of the longer term benefit to the child. I want to move, having highlighted those three elements, I want to move to the last part of my presentation, where I'll share with you three specific approaches that we have documented in various settings. And this is the lighting the candle part of it. And we have evidence that shows that they really do work in terms of improving child protection. And so these are the elements that we are promoting as the African Child Policy Forum to different actors to consider if they want to make their child protection policies much more effective, sustainable, and scalable. I'll try to be brief. The first one is really, and we have done this, is identifying and scaling up community initiatives, especially in a resource-constrained continent like ours, where governments are not able to reach out to every single child, down to the child in the last mile. There's a big role for community initiatives, community designed and developed solutions really, to really play a part in complementing government child protection systems. And so we documented in a 2021 report that we titled Here to Stay, Homegrown Solutions to Violence Against Children. And what we documented were local solutions designed by communities, owned by communities, and really conceived by community members to protect their own children. And so they are built in a way and designed in a way that there's local ownership, there's local relevance. They are led by the men and women in the village. And they demonstrate very well and apply the traditional approaches to parenting. And so these were rolled out. They did not require any training. They did not require any external facilitation because the community generally has a way of doing things. So it's just about organizing this into a more structured, organized community mechanism. And so that has worked very well. And it's worked easily because, of course, when you own it, when communities own it, then they're more likely to run with it rather than when we bring out external models and ask them to replicate them. And so what we as the African Child Policy Forum have done is we identified 10 different solutions from different countries, Zimbabwe, Niger, Ghana, Sierra Leone, and we documented those and are trying to roll them up and scale them up in a way that other countries can then adopt them and see how they can borrow from them, but still localize them. So that's one important part about locally grown home solutions. The second one, and we have a bit of work that we are doing on, can you hear me?
Yes, we can hear you. Joan, we've only got 4 minutes left, so can I ask you to try and come to the end quite quickly?
Yes, I'll do that. I'll match the last two. Really is on the part of social protection programs. And it is quite promising that we've actually documented at least one form of either cash transfer or in-kind transfer in every single African country. And so that is quite promising. But how do we make sure that we are linking child protection to social protection programs and economic policies that really can create greater benefits, because they prevent children from becoming vulnerable. They prevent families from getting into the crisis that force families, for instance, to compel girls to get married, that pull children out of school and make them more vulnerable to violence. So that's one of the things that also needs to be promoted. But the only limitation is that a lot of these social protection programs right now do not have what would have been very useful linkages with violence prevention, with school enrollment, with health indicators, because then it would have a more increased and multiplied effect and benefit to the child. And that echoes the importance of having social protection policies that are not unidimensional, but multidimensional, and bring the different players together to the table. I think I'll stop there. I'll probably have discussed a little bit more about the economic side of things, but I think I'll stop there for the purposes of discussion. Yeah. Thank you, Fiona.
Thank you, and thank you for coming back when you were cut off. There's only 2.5 minutes left, but I just want to ask, there's a question in the chat, and I just wanted to put this out both you, Eileen and Joan, is how can Campbell systematic reviews be more policy relevant in child protection, which seems a really good way to end, to give us a steer going forwards.
Should I go first?
Please do.
And this, my response is going to touch really on something that Lucie raised as well, about having research that can then be scaled out and adapted to different contexts across the world. Because what you find in Honduras is very different from what you're going to find in Bangladesh. But still, these children will be threatened, one by organized gang violence, but another by extreme weather events that cause the child protection systems to be stretched and to be strained or to break down. So how do we, in our research, produce models and recommendations that can be adapted, modified to different contexts? That would be my biggest ask.
Thank you. Eileen, you've got 1.5 minutes. Oh, you're on mute, Eileen. It's just unmute.
Yes. Super. I didn't know I'd gone on mute. Anyway, sorry. Am I unmuted now?
Yes, you are.
I think in rich countries, which Britain was until our Prime Minister crashed the economy, for me, the area that needs most attention is the prevention of problems. You know, Fiona's work on parenting is fantastic for that, of actually making more resilient parents and the child's general experience. So the public health approach is where I would love to see a lot more well-evidenced arguments that could persuade even a right-wing politician that there might be a business case for spending money on making children's childhoods safer and more nurturing. So that's a local point of view, that we're going in the opposite direction, and I think that you know, we're creating the ideal conditions for more violence and more problematic development of children. So I think, you know, people get too hooked on child protection as just the violence to a child, but the society not providing a nurturing environment is also very important. But it may be outside your remit, because you can't do everything.
That feels like, I know that we're being extended, allowed seconds as at the end, but that feels like a really lovely way to end. And just leaves me just to thank my co-chair, thank each of you again just for giving up your time and preparing such fascinating presentations and giving us lots to think about as well. I mean, Joan, you just mentioned the importance of data as well, and you know, lots of things that we can reflect on, and I hope that we can draw on you as well as we look for ways to go forward in the child and adolescent wellbeing group within Campbell. Thank you ever so much. Thank you for all who've attended.